Well, my name is Doug Kelling, and I'm an internist in Concord, North Carolina. I practice general internal medicine, but I also have my specialty boards in pulmonary medicine and lipids. I do both inpatient and outpatient internal medicine. I am employed by the hospital. Our practice has implemented electronic medical records over the past year. This was a hospital-wide project. Because of this, we've completely eliminated all of our paper charts. We don't need those employees to man those charts, and it has greatly improved our efficiency. Talking about the Inscrybe tool and how it fits in with the rest of the electronic medical record, I think is analogous to think about how an automobile or an airplane is constructed. And I think Inscrybe is one of those subcontractors that brings a very important product to the table. And it's important that that be then integrated into the other parts of the electronic medical record that we have. I feel more secure, much more secure about the record that we have, that we haven't lost papers or they've fallen out of the chart or they can't be found. I feel more secure that we have got the total medical record. So trying to understand the different functions of the healthcare team that I use for taking care of our patients, I think is very, very important to understanding how we can best use your system. And I think that the key to that is the flexibility of the system so that it's not one way for everybody. All medical practices, in terms of what we're looking for working with different healthcare agencies, is strictly their approach to the patient. Does the patient come first for them? Are they there to do whatever is necessary to help the patient out and the family? I think that the Inscrybe program is invaluable in building a relationship that I've just described between the agency and the physician, the agency and the patient, and the physician and the patient. The system is designed to make it easier to review the orders and to sign the orders. It's more efficient in terms of getting it done more rapidly. In other words, it's easy to use, and there's documentation about exactly who was involved with the process, whether it be my staff, whether it be me, whether it's someone at the agency. So we have a trail, an electronic trail of the process from the time the agency sent the order to me, to when my staff reviewed it, to when I reviewed it, to when it was signed and sent back. It also gives me greater flexibility because I don't need to be in the office to sign that medical record. Using my laptop with a Wi-Fi or other remote, I could be in an airport in Dallas, Texas. I could be in a hotel in New York City. I could pull it up, review it, and sign it, which I obviously couldn't do if all I had was paper waiting for me when I got back from my trip. It's a huge asset. It's a huge asset. It really speeds up the whole process on both sides. And I think it is critical for any agency that I work with that they have this capability. And we are currently in discussions with every single agency that we work with who are involved with us taking care of patients to encourage them to use this system.